A normal course, though, is early in the process. Remember, as I mentioned, arthritis is a wide spectrum of process, if you will. Early on, maintaining motion and maintaining strength. And that's not just strength of your knee, it's strength of your hip musculature, your butt, your glutes, all the way down. Weight-bearing exercise is still good. Making wise choices. If you already have a degenerative knee, maybe you can decrease your mileage running and switch to get some pool time in, cross-train, elliptical time in, get your heart rate up, maintain muscle mass without pounding on a joint. When it comes to actually meeting somebody, we very commonly will, if they haven't been, we would start somebody on oral anti-inflammatories, Motrin, Advil, Aleve, there's some prescription ones, and use them preemptively before an athletic event or before a day in the garden or something like that, or a round of golf, so you can enjoy it and still not suffer the consequences. Injectable medications, if it gets beyond that, very commonly we'll use an occasional steroid injection, used sparingly and used in low enough doses. You can actually do that for a long time. If somebody has good motion, good leg strength, I certainly have patients I've injected intermittently over 4 or 5 years, and they're still happy and they're still staying out of the operating room, which I think is what you're after. It's not just meeting a surgeon, it's actually avoiding. You'd like to not meet in the operating room, which is fine. Beyond that, a lot of press was given to something called viscosupplementation, or Synvisc is one of them. Hyalgan, Orthovis, there's 5 major ones in the market, but that's an injectable protein that improves the joint viscosity. Limited population for that. It has to be, number one, it's only FDA approved for knees. You can only inject that in knees. And it really only works in an early stage of arthritis. If somebody has complete bone-on-bone arthritis, you're wasting their time and money by putting anything in that joint aside from a joint replacement, quite honestly. And even our governing body, the Orthopedic Academy, came out with a statement basically saying that there's no clear benefit of using it. That being said, we use it a lot because we see people in the younger age group, they're trying to avoid joint replacement at a young age. And so you tend to bend indications a little bit. You might say, well, you got advanced arthritis, but you're 45 years old. Let's try this. The worst case scenario is you're disappointed, but we would sure love to not have to do a joint replacement in a 45-year-old if it's avoidable. But if you've exhausted everything else, personally, I'm not a fan of people putting things off just for some arbitrary number. Like, I'm going to wait till I'm 63. Well, if you're 58 and you're aiming for 63, but in the meantime you've gained 30 pounds and you have bad blood pressure and you're deconditioned, you're going to lose that race because you're going to get to that point in time and you're not going to have the get up and go to enjoy the next stage if you have a joint replacement. So yeah, I'm a big fan of being aggressive early on, maintain muscle mass, motion, control the pain, stay active. It's very rare I'll stop people from doing things. I'll encourage choices, cross-training, changing your equipment. Parabolic skis have really helped people enjoy the mountain without pounding as much, I think. There's some technology changes. There's great things you can do with orthotists, with footbeds, with your therapist to improve joint alignment within your ski boots, for example, or within your footwear. So you can do a lot of tweaking before you have to have a discussion about a big operation. So we can all agree that you can avoid us, if you will, as long as possible.
If you only have knee pain during the ski season, does it do any good to have like a baseline X-ray taken before the ski season when you're perfectly comfortable, and then so it helps you diagnose?
It can. There's a couple of just hearing that history, you can make a few diagnoses. But what's probably more bang for your buck is if a person doesn't already, is actually anticipating that and spending a good month, 6 weeks before the ski season getting ready for it, protecting the joint.
This is Telluride. People,
okay.
Most people are doing that all year round anyway.
Yeah, okay. I think those preseason ski classes are still pretty packed. But so you wouldn't expect a baseline X-ray to change over the course of the year. If it's activity-related pain, it's usually mild wearing or a process called chondromalacia where you're wearing the joint a little bit. But in X-ray, it's certainly a valid concept. It probably wouldn't change what you did. Usually it would be working on specific muscle groups. But sometimes there's also some bracing or taping techniques that get you through the season happier, longer. You get to March and in good shape.
Does glucosamine and chondroitin work?
Great question. Not sure. The best study that's out there is an NIH study that used, I think it was cosamine DS. So they actually used, because it's such a multi-billion-dollar industry, you don't know what's different between all the different products out there. So there was one really well-designed study done by the NIH which did not show a clear benefit. That being said, it's such a relatively benign medication. It's cost-effective. It's, let's say, for the sake of argument, $20, $25 a month, which in healthcare these days is a pretty good deal. The best numbers out there would suggest taking 1,500 glucosamine and 1,200 of chondroitin daily, and with no clear benefit, but my parents love it. And some people, no kidding, you'd say, well, try this. I have to go try it for a month, because some people swear by it. And then some people have been taking it for a long time, don't recognize that it helps until they stop taking it. And they go, man, after I stop taking it, my back hurts. But I've had a number of patients who, they don't feel a big difference in their knee, but they say the rest of their body feels better. So the short answer is, I have no problem trying it, and I actually have no problem people trying other things such as MSM, acetyldenosine, methionine. There's been a couple articles, and there's a whole slew of them. No single one is proven, but there's always case studies of people who truly think that they've got a new lease on life because of it. So if you agree to try it for a month, you've burned $25, and you might be right. I don't think there's any harm.
What
There's
about,
other supplements out there that are harmful,
I
but that's
heard
not one of
that
them.
someone told me that the glucosamine, that you don't really need the chondroitin, and the chondroitin drives the price up, and the glucosamine is what does the job.
That may be, but that's conflicted by all the European studies have shown that only chondroitin works, so I don't know what to do with that.
Okay.
A couple of French studies show that just the chondroitin does it, so you go, okay, who's financing
Yeah.
the study?
Okay.
No, I'm all for personal experimentation. You know, a month of one, a month the other, a month combined, and you might really find one that works. There's just not the data just doesn't exist to put your finger right on it and actually tell everybody the same thing. And everybody's got their best friend who has something that works better.
Right.
All right, thank you very much.
Sure.
Thank you.